MBBS Abroad versus drop year. What's better for NEET aspirants? The decision after NEET. Every year, right after NEET results are announced, there is a moment of silence in millions of homes. It's that same question playing out in thousands of families. What do we do now? Maybe your score was not enough for a government college, or maybe it was close, but not close enough. And now you are standing at a crossroads. The most common advice: take a drop year, give it one more shot. And on paper, that sounds reasonable. You are just 17 or 18. What's 1 year? Right. But let's think deeper. A drop year is not just a calendar year. It's a full stop on your life for the next 12 months. You pause your academic growth, your personal development, and your momentum. It's a year full of uncertainty, pressure, coaching class targets, test series, and for many, it's a self-doubt. More importantly, no one guarantees success after a drop year. You are gambling a full year of your youth for a chance that may or may not pay off. Meanwhile, there is another route that briefly gets discussed openly: starting your MBBS education immediately abroad. A path with structure, timelines, and clarity. And most importantly, progress. You are moving forward, not just waiting. But I get it. MBBS abroad is misunderstood. People assume that it's too expensive, or it's not accepted in India, or it's second-class education. In this video, we will break all of that down with real numbers and examples. You will walk away with clarity. Because in the middle of this noise, coaching ads, pressure from relatives, social media stress, you deserve real information, honest guidance, and the full picture to make the best decision for your future. This is not just about where you will study, India or abroad. This is about how your medical journey begins and whether you are truly using your time, energy, and finances in this most effective way. So let's unpack this together. The NEET drop year reality. Let's talk about the most misunderstood year in a medical aspirant's life, the drop year. In 2024, more than 21 lakh students sat for NEET. And how many government MBBS seats were available? Just around 1.1 lakh. That's less than 1 in 20 students making it to an affordable, high-quality medical college in India. That leaves a massive number of students in a dilemma. Private college or drop year? Private college in India charge anywhere between 80 lakhs to 1.5 crore for an MBBS seat. And that's just tuition, hostel, clinical exposures, materials, and hidden charges take even higher. Many parents can't afford that. So the fallback option becomes a drop year. Another 365 days of coaching, revision, mock test, more pressure, all while your classmates begin their degree, engineering, design, law, MBBS abroad. Even those with lower NEET score than yours. And here is what people don't tell you. Most students who take a drop year improve their NEET rank by only 5-10 percentile, not marks percentile. That often is not enough to make the jump from close to qualified. And think of the emotional cost, the anxiety, the what ifs every single day. The daily struggle to stay motivated when your friends have moved on. Many students face burnout halfway through the year, and a large number don't even finish the year with the same energy they started with. Financially too, it's not a small decision. Coaching classes charge 1 lakh, 2 lakhs, add hostel rent, food, test materials, mock exam, and other costs. It easily crosses 3 to 4 lakhs for a year where you are not getting a degree, not gaining new skills, just hoping for a different result. And if it doesn't work, again, you are left with two equally heavy options: take another drop or pay the heavy fees of private MBBS. This is why many students and families are now seriously considering MBBS abroad, not as a compromise but as a strategy. It's structured, it starts on time, it costs less than private Indian colleges, and it gives a student a 1 year head start on their medical education. Let's dive into numbers. Side by side, comparisons of drop year versus MBBS abroad. We will look at timelines, expenses, ROI, clinical exposure, and where each path leads after 5 years. Cost and ROI comparison. MBBS abroad versus drop plus private college. Let's now bring some numbers to the table because this is where decisions become real. If you don't get a government seat after your first NEET attempt and you decide to take a drop year, you are not just risking your time, you are also investing heavily into the year itself. Like we mentioned earlier, 1 year of quality NEET coaching costs anywhere between 1 to 3 lakh depending on the city, institute and the kind of program you join. If you are relocating to a quota type city or a hostel town, factor in accommodation, food, transportation, study material, all of that can push you cost up to 5 lakhs or more. Now say after that drop year, you still don't get a government seat. Most students at this point are pushed into expensive private colleges with fees ranging from 15 lakhs per year to 25 lakhs per year. Over 5.5 years, that's 80 lakhs to 1 crore total. And this doesn't even include post-graduation yet. Compare that with MBBS abroad in countries like Georgia, Kazakhstan, Russia, or even Philippines, Timor-Leste, Nepal. The total tuition fees in many good universities is between 15 to 40 lakh for the full course, entire 5 to 6 years. Living expenses vary by country, but let's estimate 4 to 6 lakhs per year for food, accommodation, transport and other basic costs. That still keeps the total cost within 30-40 lakh in most cases. That's half the price of a private MBBS in India, and in some countries even less than half. And there is no drop year cost. You start immediately, no delay in your medical timeline. Now let's talk ROI, return on investment. When you take a drop, there is no academic return during that year. You are not progressing, but MBBS abroad starts the clock. You graduate 1 year earlier than drop year students and you start earning earlier. If you clear FMGE or next, you can start working or do PG preparation while your peers are still in their internship year or need PG struggle. And if you plan to go for PG abroad, US, UK, Germany, this earlier start gives you more time for licensing preparation like USMLE, PLAB or German B2 exam. This is what I mean when I say MBBS abroad is not a second option. It's a faster, cheaper and many cases a smarter pathway, especially when the goal is to become a global doctor or to finish education without lifelong debt. Education quality and licensing preparation. Is MBBS abroad recognized and competitive? Now let's address the elephant in the room. Is MBBS abroad good quality? Will I be able to clear the screening test? Can I practice in India? Fair questions. And let's answer them. MBBS from a WHO listed and NMC following abroad is completely valid for Indian students. After finishing your degree, you are required to clear the FMGE or next exam before getting a license to practice in India. There is no different than what Indian private colleges students will face. Next is mandatory for everyone, domestic or international. Now the FMGE pass rate has traditionally been lower for some countries, but this is not because of low quality education. It's often because the students are not mentally prepared for a licensing exam at the time of graduation, and when they went there, NEET was not compulsory, but now NEET is compulsory. Many universities abroad are now integrating NEXT or FMG based training from year 1 onwards. Some even conduct mock tests every semester, and students who are serious, who study consistently, perform very well. In fact, many coaching providers like DAMS, DB, MCI, Marrow and other have started FMG specific modules, crash courses and test series for students studying abroad. Online platforms have equalized access to quality exam preparation. The clinical exposure is also improving. Countries like Georgia, Russia and Philippines allow clinical rotation in major hospitals during later years of MBBS. Just like India, and some universities now offer tie-ups with hospitals in Germany or the UK or for observationship and PG pathways. Let's also look at the big picture. If you do MBBS from India, your PG pathway is largely limited to next PG, which has only around 50,000 seats. But if you study abroad and prepare smartly, you can aim for USMLE in the US, PLAB in the UK, or even pursue PG in Germany or Australia with lower cost and better work-life balance. So yes, MBBS abroad is academically rigorous and it's improving every year. But just like in India, The outcomes depend on the student. If you treat it like a backup plan, you will get backup results. But if you treat it like your main plan, you will go far. Career after MBBS, PG pathways, global opportunities, and long-term outcomes. Let's shift gears now and talk about what really matters after MBBS. Career outcomes. Whether you study in India or abroad, your ultimate goal is to specialize, get a stable job, and build a respectable career. So how does MBBS abroad fare when it comes to PG and long-term growth? Let's look at India first. If you graduate from a private MBBS college here, your next hurdle is next PG. Every year, over 2 lakh students apply for about 60,000 seats, and among those seats, hardly 15-20,000 are in clinical branches like medicine, surgery, gynecology, or orthopedics. The rest are preclinical or paraclinical. So even after spending 1 crore on private MBBS degree, many students end up with DNB in a non-clinical branch or repeat PG attempts again and again. Now let's say you studied MBBS abroad and you planned well. If you clear FMGE or next, you can sit for NEET PG just like any Indian graduate, but you also have more choices. You could start preparing for USMLE and apply for residency in the US. The timeline is longer, yes, but the outcome is a globally recognized PG degree with excellent salaries and work-life balance, and during PG you are getting a stipend or maybe PLAB and GMC registration in the UK. A growing number of Indian students are taking this route. Some countries like Australia and Germany offer free or low-cost PG medical programs. You just need to learn the language and pass a few licensing exams. Point is, MBBS abroad opens more doors if you are willing to explore. And let's be realistic. Even if you don't want to go abroad permanently, your Indian options remain. You can practice as a GP, do super specialty later, or even crack PG from India after a couple of attempts. But without a drop year, your journey is already a year ahead. You get time, and time is the most underrated advantage. You have seen students who planned this smartly. They got their MBBS from abroad, started next preparation by year 3 and applied for PLAB by year 5 and were working in NHS hospitals by age 26, while their batchmates in India are just beginning PG preparation. That's what we mean when we say think long-term global strategy, not just local struggles. Final thoughts, why MBBS abroad makes more sense than a drop year. So what's the verdict? If you are a student who just missed out on a government seat this year and you are thinking of taking a drop year, take a deep breath and think clearly. You are about to pause your life for 12 months. Spend 3 to 5 lakhs more. Put everything on hold. Friendships, progress, confidence, and reattempt an exam that strategically doesn't shift drastically for most repeaters. And even if you improve by 40 or 50 marks, that still might not guarantee a government MBBS seat. So then what? Private college for at 80 lakh or another drop? What if instead you use this moment to start your journey? There are NMC approved universities abroad that offer quality education, English medium teaching, modern campuses, and clinical exposure, all for less than half the price of a private MBBS in India. The degree is valid, the path is structured, and if you prepare right, you can clear FMGE or next, do PG here or abroad and achieve your goal of becoming a doctor without wasting time, money, or mental health. We are not saying MBBS abroad is easy. Nothing in medicine is easy, but it's practical, it's efficient, and it's more realistic than banking your entire future on one number in one exam. And here is the final point. Your value as a doctor will never come from your NEET score. It will come from how you learn, how you treat, and how you grow. So make smart choices, not just emotional ones. We hope this video helped you look at the full picture. If you want to explore good MBBS abroad options, safe, NMC approved universities with good curriculum, clinical exposure and next FMG preparation, our team is here to guide you. This one decision can shape your next 10 years. Make it wisely. You will become a doctor and you will become a global doctor. Comment your questions, subscribe this channel, push the bell icon, and definitely we will be the answer of your all questions. So follow me and join the Global Doctors Drive at Mentor Universe. Thank you very much.